Hello and welcome to this week's Lunch and Learn with Village Physical Therapy. Today's topic is, what is the rotator cuff? How did I hurt it? And what can I do? My name is Keith Bailey. I am the director of the Batavia Village Physical Therapy Clinic. I have been with Village Physical Therapy since 2011. I'm a graduate of Duval College's class of 2002. All right, so what does the rotator cuff do? All right, so the rotator cuff keeps the ball of your upper arm bone, or the head of the humerus, centered in your shoulder socket, which is the glenoid of the scapula, while larger muscles, such as the pectoralis, the deltoid, and the latissimus dorsi, move the arm. It helps you raise and rotate your arm, as well as to use your arm overhead. And it is very important in overhead sports like baseball, tennis, swimming, and volleyball. It is also very important for a lot of other normal daily activities, such as lifting and reaching. So what is it? The rotator cuff is a term that refers to a group of four muscles. These four muscles are the supraspinatus, the infraspinatus, the subscapularis, and the teres minor. If you look at the picture on the right-hand side, the first picture is a view of your arm, of a right arm and shoulder blade from the front, if the rib cage had been removed from view. The picture on the right is of the shoulder blade and the humerus from the back. Okay, so the subscapularis is on the front surface of the shoulder blade and attaches to the front of the humerus, whereas the back side of the shoulder blade has the other three muscles, the infraspinatus, the supraspinatus, and the teres minor. So the supraspinatus. The primary function of the supraspinatus is stabilization of the head of the humerus in the glenoid of the shoulder blade. So again, the head of the humerus is the top of the upper arm bone, and the glenoid is the socket part of the shoulder blade. Okay. Supraspinatus also helps to lift the arm out to the side into a motion that we call abduction or abduction. The infraspinatus. So again, its primary job is stabilization of the head of the humerus in the glenoid. And then it also performs external rotation of the humerus. As you can see in the picture to the right, that gentleman is externally rotating his arms with that exercise. The picture at the bottom shows where the muscle starts and where it attaches. So if you look at those lines in the picture and imagine those lines shortening and the ends of attachment getting closer together, that you can kind of picture how it would make the arm move. The subscapularis. Again, primary job, stabilization of the head of the humerus in the glenoid, and it also prevents anterior dislocation of the humerus by traveling across the front of the shoulder. dislocation of the shoulder anteriorly would push against this tendon as it is currently constructed. It also is a very strong internal rotator of the humerus and the arm, and it also helps to pull the arm towards the body into a motion that we call adduction or adduction. The teres minor. So the teres minor, again, has a very strong role in stabilization of the humeral head in the glenoid, and this also assists for external rotation of the humerus, much like the infraspinatus. So how do we injure the rotator cuff? Well, it's not always an easy answer, but some things that have a tendency to injure it are repetitive activities where it is consistently strained. A fall on an outstretched arm can do it. Very heavy lifting can certainly cause this injury. Long-term wear and tear, okay, just a lifetime of use and abuse can result in this injury. And poor posture and poor movement mechanics can actually have a strong role in injury to the rotator cuff as well. What kinds of injuries are there? Okay, so there's several different injuries that can occur to the rotator cuff. You can have a partial tear of any of the tendons, or you can have a partial tear of more than one. Okay, you can have a complete tear of one of the four tendons, or you can have a complete tear of more than one, or you can have a complete tear of one and a partial tear of another. Also impingement syndrome. The tendons aren't necessarily torn, but they're getting pinched between the bones. Bursitis, tendinitis, tendinosis. Okay, and we're going to get into a little bit more detail with each of these. So common symptoms of a rotator cuff injury are obviously pain, limited range of motion, the severity of which can really vary. Weakness, again, the severity of which can really vary quite a lot. Functional impairment, meaning normal daily activities that you're just not able to do because of weakness, pain, or limited range of motion. Also, difficulty sleeping can be a common symptom. So a rotator cuff tear. So this can be caused by an acute traumatic injury, such as a fall on an outstretched arm, or repetitive activities, or just a gradual degeneration of tissues due to long-term wear and tear. Tear can be partial or complete. But an interesting thing is either a partial tear or a complete tear could be asymptomatic. There are many people who have rotator cuff tears who are what are referred to as copers, and they really just have no significant symptoms or loss of function. Impingement. So this is where the soft tissues of the shoulder are pinched between the bones of the shoulder. Several possible causes, including decreased space due to arthritis or bone spurs, poor biomechanics or posture, an acute injury, or possibly even just weak rotator cuff muscles can result in an impingement because that head of the humerus is not being properly centered in the glenoid or the socket of the shoulder blade. So if you look at the picture on the right, the one on the left, the part on the left shows a healthy shoulder that is not being pinched, whereas the one on the right shows a shoulder that is being pinched and thereby having problems. Bursitis. So bursitis can be caused by an acute injury, repetitive activity, or even infection. The swollen bursa fills the limited space that is available there, which causes pressure on the soft tissues and creates a pinch point. So again, if you look at the picture on the right-hand side, they have like a bit of an example of what a normal bursa may look like, and then an example of an inflamed bursa. The inflamed bursa is certainly much larger, but you only have so much space in that area, and so that inflammation of the bursa increases the pressure on those soft tissues and tendons that are also passing through that area. Tendinitis. All right, so tendinitis is the acute inflammation of the tendons of the rotator cuff. Possible causes include heavy lifting, repetitive activity, acute trauma, or improper activity technique. Okay. So in the picture over here, you can, again, they've kind of illustrated what a tendinitis might be. So part of that tendon, which the job of a tendon is to attach muscle to bone, part of that tendon is inflamed, irritated, and therefore painful. Tendinosis. So tendinosis and tendinitis very often are used interchangeably, but they are technically different processes, okay? Whereas the tendinitis is an acute or a new inflammation, tendinosis is more of a chronic or long-term condition that results in degeneration and micro tearing of the tendon. It's typically caused by long-term overuse, and it typically starts as tendinitis, but eventually progresses into a longer-term issue, which is what we refer to as tendinosis. So rotator cuff treatment. You know, we went over all these common problems. What can we do about them? Okay, so very common treatment is physical therapy. If you come to physical therapy for a rotator cuff problem, we are going to work to decrease pain, restore range of motion, decrease inflammation, improve strength, and improve posture. Okay. Also, your doctor may recommend medications such as a pain reliever or anti-inflammatories. Steroid injections or cortisone injections are also pretty common with these. The steroid injection is a potent anti-inflammatory meant to calm down the inflammatory process in those tissues. And then, of course, there is surgery for problems that do not respond well to the more conservative treatments. So here at Village Physical Therapy, we do offer comprehensive treatment for rotator cuff injuries. Our PTs can evaluate the cause of your shoulder issues and create a program to help. To make an appointment, you can contact any of our offices in Leroy, Gananda, Walworth, or Batavia. You can also contact us by email at info@villagefit.com, or you can go to the website www.villagefit.com and click on the Request an Appointment tab. Also, direct access to physical therapy. So since 2006, New York State residents have been legally able to see a physical therapist without a physician's prescription. This is covered by most insurance companies. Some limitations tend to be with workers' compensation, Medicare, or no fault. The direct access allows a patient to be seen for up to 10 visits or 30 days, whichever occurs first, before a prescription is needed. So if you're having shoulder pain and having trouble getting in to see your doctor, you can certainly come in and see us first. And then if at some point a prescription is necessary, continue down that path. These are just a few references that you could look at if you were interested. Some websites and whatnot that have some of the information that I presented to you on it. So thank you very much for attending. I hope this was informative. There are a lot of different types of shoulder injuries, and they are not all created equal. So give us a call, and hopefully we can help you out. Have a great day. Bye.